What struck you as one of the biggest changes just within hospital care that you witnessed beyond obviously the emergence of the antibiotic era?
Well, I think the thing that struck me the most was we did not allow parents to stay and take care of their children in the hospitals as they do today. We asked them to leave the child with us, and we would see that the child was taken care of. And if we needed them, we would call them.
And I think also, as I see now, there's so much more teaching goes on than we were able to do and expected to do. And in one way, but in another way, we were teaching while we had these long stays. You know, today they have to, they need to get their teaching done in 1 or 2 days because the patients are gone. And so it really challenges the nurses much more. And of course, the other thing is all the equipment that we have today that we did not have. I can remember the first time that we used a ventilator on a patient. It was like, you know, it was like, I couldn't believe it. And today, you know, ICU is full of ventilators. And one thing that I've noticed, and I say to the nurses today too, the student nurses that I work with over in St. Clair Health Mission, I say now, when you're working in the hospital, I want you to remember that the patient is the first you do when you walk in that room. You say hello to the patient. You don't look at all those machines up there and decide what's going on and then say, oh, hello. First you say hello to the patient and then you look at those machines. And I think that's one of the biggest difference I see is that in just about every room there's some kind of a machine going. And it's a challenge to the nurses, I think, to be really conscious that, you know, and I think the nurses are being taught that too. You must remember that the patient comes first. So,
of course, another big change that I always think about is the changes of medications in the hospitals. I remember when the sulfonamides were first brought into the hospital and how we used them for everything and everybody. And then, of course, when penicillin came along, we had another great thing to get people well faster. It seems like all the things that have been invented have been to help people get better faster and to do for them, for themselves. And I remember penicillin as a young graduate nurse back in 1947 when penicillin was on the market, and I was teaching students. I was on night duty with the students, and the doctor called in an order for penicillin. At that time, we had just the penicillin powder, which you used very little of, and then we had the liquid, which we had to decide how much, if he wanted a cc or how much he wanted us to give, and then we had to calibrate the amount of penicillin that we needed. And I remember telling the student nurses that night when I was on with them, I said, I will give this first dose of penicillin because if anything happens, I would be responsible. So I gave the first dose. I went in and took the child's temperature. It was 105. And I gave the shot of penicillin, and I think I went into that room every 10 or 15 minutes wondering what effect that penicillin was going to have on that child. Well, at 2 o'clock in the morning, I went back, took the temperature, and it was down, and I really started saying my prayers. And I thought, the deep faith of the sisters has to be with me now at this time. I called the doctor, and he said, what are you calling me in the middle of the night for? And I said, well, I'm worried about this child. He said, don't worry about her. She's going to be walking around the crib in the morning. He said, let me go back to sleep and don't call me again. So I did as he ordered, believe it or not. And guess what? The baby was walking around the crib.